Hello, and welcome back to Student Nurses Success. Today's topic is hemostasis or blood clotting. Basically, you can clot too much, which is called a thrombosis, or you can have a failure to clot properly where you bleed. We are going to cover a few of the most common hemostasis disorders today: thrombocytopenia, von Willebrand's disease, hemophilia, DIC, and hypercoagulability. So here's the completed map, which is the goal for this video, to get your map to look like this. Remember, the link to the maps is in the comments section. So we're going to go ahead and begin, like usual, with our blank map. And I've cut this down just a little shorter. And first, we should cover the process of clotting. Clotting actually requires two things. It requires both platelets and coagulation factors. So if you're missing or don't have enough of either of these, you're not going to clot properly. You need both. There are several steps in clotting. The first step is that your vessels are going to constrict when there is an injury. So let's just put here vascular constriction as step one. So this is to reduce blood flow to that area. Next, we're going to see number two is the formation of a platelet plug. A platelet plug will actually form at the site to help stop the bleeding. However, that plug will not stick unless you have sufficient coagulation factors. So that's number three. You need blood coagulation. Now, there are two pathways for coagulation factors: the intrinsic pathway, which is inside the vessel. It's a little bit slower. And the extrinsic, which is outside the vessel. It's a little bit faster. Disorders such as hemophilia affect these coagulation pathways. And now step four is that the clot actually retracts and gets reabsorbed into the system. Now that's a little bit later in the process. Now let's cover the general manifestations of bleeding disorders. They include bleeding, bruising, petechiae, purpura, and even blood loss. And that blood loss can be occult, a small amount, or gross blood loss, large amounts. And remember your normal lab values. Your normal platelets were 150,000 to 450,000. Your PT was 10 to 14 seconds is a normal, and that's the extrinsic pathway. Your INR, you may adjust. And normal is 1 to 1.5, but we may adjust that higher. And your PTT is 33 to 45 seconds. And your hemoglobin and hematocrit. And these are all covered under the blood cell component lecture. So you may want to kind of refer back to that. Now, let's start with our disorders. The first is thrombocytopenia. And what thrombocytopenia is really just decreased platelet production. So your coagulation factors are fine, but you're not making enough platelets, and the platelets are made in the bone marrow. The etiology or causes include viruses, maybe autoimmune, where you actually attack your own platelets and kill them off. And sometimes it can be drug induced. And actually, we see heparin being a common cause of that, where we give you a drug and it actually causes your own destruction of the platelets. How to identify thrombocytopenia is you'll actually see the platelet count less than 150,000, but the coagulation factors will be within normal limits. Now, once your platelets are less than 50,000, you're at extreme risk of spontaneous bleeding. So the lower those platelets go, the more dangerous it becomes. Manifestations of thrombocytopenia include bleeding, bruising, and petechiae. Now, the next disorder I want to talk about is hemophilia. And yes, we're going to get to von Willebrands here in just a second, but I'd like to talk about hemophilia first. Hemophilia is actually deficiency in a clotting factor. So it's different from thrombocytopenia, where you have decreased platelet production and normal coagulation factors. In hemophilia, you actually have normal platelets and a deficiency in a clotting factor. Now, there are different types of hemophilia, and there's also different levels of severity. So there is a range. Some people can be more mildly or severely affected. The cause of or the etiology of hemophilia is that it's genetic, and most commonly it's an X-linked recessive disorder. So it primarily affects males and it's passed down through mom. Now, when we're looking at lab values, you're actually going to see that with hemophilia, you're going to actually see a normal platelet count. But what you will see is an increase in PTT, okay, because that is part of the coagulation cascade that's affected with hemophilia. The PT will be normal. Okay, so the normal PT, normal platelets, but the PTT will be prolonged and increased because that is the part of the coagulation cascade that's affected. Manifestations include your typical bleeding, bruising, petechiae. Additional ones include hemoarthrosis, which is actually bleeding into the joint. And this actually leads to arthritis over time. So, as you injure yourself or maybe fall or knock your joints, you can actually get bleeding into those joints. And so over time, the more hemoarthrosis you have, the bigger your development of arthritis is going to be down the road. We also worry about intracranial bleeding with head injuries. So if you bump your head or hit your head hard, we really worry about bleeding in the brain or increased intracranial bleeding. As far as treatment for hemophilia, we treat it with the factor that you're missing, and we go ahead and give that, and that helps the clotting. Now, von Willebrand's disease is also a bleeding disorder, and it's a genetic disorder as well. And it has to do with the deficiency of von Willebrand factor. And von Willebrand factor is part of the clotting cascade. And so patients with von Willebrand's disease, they don't have as severe a bleeding disorder as hemophilia. So they just tend to have kind of these low level prolonged bleeding. So it's not quite as dramatic as hemophilia. But we will see an increase in PTT for them, and it is genetic. All right, let's move over to DIC. DIC is very serious, and it is stands for disseminated intravascular coagulation. Now, the cause of DIC is always secondary to another serious event. So not everybody goes into DIC. In order to go into DIC, you have to have maybe a severe trauma, maybe go into shock, maybe end stage cancer, maybe well, we do see sometimes pregnancy, especially if there's a complication toward the end, or maybe a serious burn. Okay, so these are just big deal that causes that. And not everybody who has these issues will go into DIC, but if they do, the outcome is usually not real great. With DIC, we have two things going on here. We have accelerated clotting, so patients start developing clots in their bloodstream, and as you can imagine, that's not very good. That's going to cause decreased blood flow to areas. But this accelerated clotting causes a problem because it actually uses up the clotting factors, kind of burns through them. And when it's used them all up, then the patients start bleeding uncontrollably. So you kind of got this inappropriate clotting that uses up all the clotting factors that leads to massive amounts of bleeding. How we know this is going on is we usually see bleeding coming out of two or more sites. We start to see maybe altered level of consciousness if there's a bleed in the brain or a CNS bleed. We start to see all of the lab values go kind of out of whack. We see an increase in their pro time, an increase in their APTT. So we start to see all these prolonged bleeding times. We see a decrease in their platelets. And we also see this thing called a D dimer, which measures fibrinolysis, and we see that turn positive. So this is a very serious event. It's difficult to treat, and we mostly see it in the ICU. Now, our last thing is hypercoagulability or too much clotting. There are some patients that have too many platelets or too much clotting activity. And in these cases, they can actually just develop thrombosis and clots. And as you can imagine, that's not good to just be developing clots in your body. You start to have, decreased blood flow and problems. Risk factors or patients who are higher at risk for hypercoagulability include those with atherosclerosis or buildup of lipids in the arteries, those with diabetes, those who smoke, those who take oral contraceptives or the pill. We see it develop sometimes in pregnancy, and those who are maybe immobile, who aren't moving a lot, actually can start to develop clots. And there you go. There is your completed hemostasis map. So I hope you enjoyed the video today and found it helpful. Make sure you subscribe to the channel to be up to date on all our videos and have a wonderful day.